Okay, we will call the Health Services Committee meeting to order. Have approval of the previous meeting. Supervisor Gilligan. Supervisor Thomas, all in favor?
Aye.
Opposed? Okay, anyone from the public would like to address the board before we start? Seeing none, we'll go right into Rob. Always a good leadoff hitter.
Good morning, everyone.
Morning.
Morning. All right, have a few items here. Let's see, the first request is to amend the 2025 Warren County budget. And this is in the amount of $20,396 to allow for pass-through of 100% state aid from the New York State Office of Mental Health. These funds are designated for the Parsons Northern Rivers Assertive Community Treatment Team.
Okay, can I have a motion to bring this to the floor? Supervisor Wild, Supervisor Gilligan.
Mr. Chairman, might we bring 1 and 2? Looks like they're both very similar.
I have no problem with that. Rob, that work for you?
Yeah, that's fine. You want me to just review number 2?
Sure, go right ahead.
Okay, so the number 2 is a request to also amend the 2025 Warren County budget in the amount of $9,371 to allow for pass-through of state funding from the New York State Office of Mental Health. And these funds are designated for the Ascend Mental Wellness Housing Programs.
Okay, you guys want to keep your motion in second?
Yes.
Okay, any questions?
Have
Patchett?
pass-through means reimbursed.
Yes.
Thank you.
All in favor?
Aye.
Opposed? Next,
Very good. Okay, my next item is a request for an appointment to the Community Services Board for Warren County. Sharon Figler, and Sharon would be filling an unexpired term of Deidre Grieve. So the term is to run through 12/31/2027.
okay, motion to bring it to the floor.
Queensbury resident.
Supervisor Thomas, second. Supervisor Wild, any questions? All those in favor? Opposed? Okay.
Okay.
4.
And then the next 3 are requests for reappointments to our Community Services Board. So I don't know if you wanted to do those separately or together.
Yeah, we can do those all together.
Okay, so these are individuals who are currently sitting on the Warren County Community Services Board. We have Belinda Bradley of Glens Falls. We have Christina Mastriani of Lake Luzerne and Susan McManus of Glens Falls. Those terms would run through December 31st, 2029.
Okay, motion to bring this to the floor. Supervisor Wild, second. Supervisor Patchett. Any questions? Okay, all those in favor?
Aye.
Opposed? Carries.
Next request is request to approve renewal of a 2-year lease agreement for our office space for the term January 1, 26 through December 31st, 27. This would be a 2-year lease agreement with Ascend Mental Wellness to provide office space for the Office of Community Services. Our rent expenses is listed there. We've been there for a number of years and it works out well for us to be located there.
Okay, motion brings to the floor. Supervisor Patchett, second. Supervisor Gilligan, any questions? Okay, all those in favor? Opposed?
Aye.
Okay. Carries.
No, I'm not opposed.
I know
I
that.
just said okay. I was late in with my
You're
eye.
moving your hands like it was safe, so I just went ahead.
Okay. Next request is request for our 2026 state aid contracts. And these are ongoing services authorized by the Warren County Community Services Board. And Schedule A attached. These are the community agencies that we work with to provide the behavioral health services.
Okay, can I have a motion to bring this to the floor? Supervisor Thomas, second. Supervisor Wild. Any questions? Okay, I had a couple of questions. So where are all these people? What's People USA?
Okay, so People USA is a peer-run agency, and peers are people who have lived experience with mental illness, and they're at a point in their recovery where they're able to give back and help other people. They're often their approach is welcomed by individuals that are struggling with mental illness, because obviously it's somebody who's also been there and been through the same types of experiences. They operate a respite house at 6 Montcalm Street in Glens Falls. So they do some overnight respite. People can go there and get a break from their current, environment and get support from peers. And they operate a warm line, so people can also call them 24/7 to get support.
Okay, my other one here was Northern Rivers Parsons Child and Family Center.
And we contract with them for mobile crisis services and also for the ACT team, which was the Assertive Community Treatment Team. So that's a team that goes out into the community and meets with people and can do treatment actually out in the community versus like an office setting.
Are they local?
Yes, they have offices on Bay Street or Bay Road.
Okay, then we'll call the question. Oh wait, did we get?
Yeah, I have a question. It doesn't say where this funding came from.
Yep, so this is state aid from the New York State Office of Mental Health.
So it's 100%?
Everything except, let's see, there's a little bit of funding under the Warren Washington Association for Mental Health and also the Liberty House. And I don't have those amounts, but they're less than 10,000, I think, each. That is actually county dollars.
Okay.
The rest is 100% state aid.
Okay, we'll call the question. All in favor?
Aye.
Opposed? Okay,
My next request is also for some 2026 contracts, and this is for respite services for youth. And we asked for this on a separate resolution because on our state aid contracts, we fund those with quarterly advances to the agencies. With our respite services, providers bill us for the actual respite provided, and then we reimburse them.
okay, can I have a motion to bring this to the floor? Supervisor Wild, second Supervisor Thomas. Any questions? Okay, I have one. Hampton Community Human Services. Are they local?
They're located in Saratoga County.
Okay,
And so we do utilize them sometimes if our other providers don't have any availability.
so there might be a savings if they don't do a lot of work in Warren County? I mean, you've got it 69,000 here. Is that we pay them out all at once, or do we bill them, or?
No, the way it works is there's one pool of funding, the 69,000 total, right?
Okay.
And then these agencies, when we have a need for youth respite, will go out and inquire with the agencies. If an agency has availability, they'll provide the service, then they bill us, an hourly rate for those services.
Okay, and you think all these things work fine?
It's been working well, yeah.
I
We
mean, I
don't
see a
use-
number of them.
We don't use all of these agencies.
Okay, any other questions, Supervisor Wild?
It's only barely $70,000. Do we ever run over budget on the year for this?
We have not been running,
Is we limit services or we just don't need it?
just hasn't,
Okay,
hasn't been there,
right, I'm good.
been
Okay,
sufficient.
any other questions? Okay, we'll call the question. All in favor? Oh, wait.
No, go ahead.
No, that's not a question. I'm gonna try to put their hand up. I always think that's a
I got it.
question, but,
Sorry.
okay, so we'll call the question. All in favor? Opposed? Okay, carries. Anything else, Rob?
All I had.
Okay, well, thank you very much. Now we got a question.
Rob, you stay. I think we should tell the committee. I had a change of heart.
Okay.
Okay, so.
So just,
Last Friday, Friday the 21st, Rob and I, in the evening, Rob and I attended a session down at Ascend and Rob's headquarters on Maple Street. There was a complaint brought by some community members in the city of Glens Falls about residents in the Genesis House, which is on Chester Street. And the Genesis House is restorative services for people with psychiatric issues. It's an early stage developmental program. Takes them through various phases of group therapy and things like that. And there was a complaint primarily focused on one individual, I think, but possibly others over the course of, it's been there for 30 years, I guess. So just wanted to make you aware, we're going to have follow-on discussions and see what we can do to provide assistance through Rob's office. And anything you want to add to that?
No, not really, just that these, complaints were something that we've just sort of recently learned about. But although we've also learned that some of this has been going on for a while and we just weren't aware of it. But we're kind of developing different strategies. We're going to be calling some case conferences, looking at the clinical treatment. We're going to be working with the agency. John and I are going to meet with their CEO, see if there's any other ideas. So there's some different strategies we're working on to try to address the problem.
And who brought about the complaint? Was it local?
I think it was some neighbors.
Neighbors from
Neighbors.
across the street and behind the house.
Okay, is that it?
But we'll do what we can to try to address their concerns.
Okay, thank you. Okay, we're all set with you, Rob. Thank you very much.
All right, thank you.
Dee, guess what?
Well,
You're elected.
morning, everyone.
Morning.
Morning.
So I have 3 items on my agenda. The first one is to submit our annual update to the 4-year plan to the New York State Office of the Aging. This covers the period of April 1st, 24 through 3/31/25. Yes, it has passed. We received the information on 9/3 and it was due on 10/31.
Okay, can a motion to bring this to the floor? Supervisor Gilligan, second. Supervisor Wild. Yeah, I kind of noticed our date on this was November 18th.
Yeah.
Okay, well, any questions? Okay, all those in favor? Opposed? Okay, carries. Number 2.
Number 2 is permission to amend our contract with KLC Property Management for the snow removal at our Bolton Meal site. It basically increased $5 an occurrence from $80 to $85.
Okay, can I have a motion to bring this to the floor? Supervisor Patchit, second. Supervisor Gilligan. Any questions? All those in favor? Opposed? Carries.
Number 3 is permission to amend the Warren County budget to reflect an increase in unmet needs funding. We received an additional $612,430 for the period of April 1st, 25 through 3/31/26. And unmet needs funding is used to cover what the county overmatch would be or to reduce any wait lists that we would have for our services. So for Warren County, I wanted to amend this year's budget to increase it $330,000 for Warren County, and then we'll do the additional amount next year.
Okay, can I have a motion to bring this to the floor? Supervisor Gilligan, second. Supervisor Wild. Any questions? Okay, seeing none, all in favor? Opposed? Okay, it carries.
That's all I have.
That's it?
Yep,
Thank
that one you guys should be happy about. I mean, it reduces the county overmatch, so,
I'm very happy with it.
all right. That's all I got.
Thank you very much.
All right, thank you guys.
Have a nice holiday season.
You as well.
Waiting now on public health. He is. Barry Phillips. Pointed out.
Anybody need
ladies.
a packet or is everybody good?
I don't know about them, but I'm good.
Good.
Think we're good.
There've been no changes. Well,
You have a different packet than we have, is that?
nope.
Oh, okay.
Okay, you're on.
Have a special one. So good morning, everybody. Hope everybody had a nice holiday. I only have one resolution request, this month. And that's to amend our health services certified home health agencies therapist contracts. to reflect increased rates to retain and recruit our therapists. The rate increase is needed to retain our agency's current therapists and recruit additional therapists so that Health Services has the capacity to accept referrals, requests, and therapy-related services. When
Okay,
we went through the budget process, we eliminated a position in anticipation of this request.
okay, can I motion to bring this to the floor? Supervisor Wild, second Supervisor Gilligan. Any questions? Look this over, it wasn't very much.
No.
Okay, seeing none, all in favor?
Aye.
Opposed? Okay, that carries.
All right, under discussion items, we have our report of revenues and expenditures, so I'll turn that over to Ton, and then she can also do the comparison report as well.
Okay, attachment number 2 is our revenue and expenditures as of November 5th. Gives you everything we are currently, well, we did now since then, September billing was done and accrued in this amount, and we were working on closing October. And, down below with our salaries, you'll see that we're 71.38% of the budget, where last year at this time, we were at 82.12% of the budget. You'll see that overtime and part-time salaries are down, which is good, and we don't anticipate that to change at all till year end. And then on page attachment 3, just giving our comparison from last year to this year to give you a good idea where we stand. Salaries we just discussed, equipment, our big purchase this year has been, we've had an infrastructure grant. So most of those funds there, over 200,000, is the purchases of stuff. We're just going into phase 4 now. We finished the first 3, and that's a lot smaller. The bigger ones were all done. Most of our office has all been completed, so that's good. The other thing just to note is that we did purchase a vehicle this year, and also we have our child passenger car seat grant, which they've been working on getting, and they've been getting a lot of car seats out. So that's been a really good program to work with. We did just order I guess a template, a sample of a car seat, so we can show parents how to lock it in and bring that to different facilities and places if we can need to show anyone. So we're in the works in getting that in. Under contractual expenses, we are a little bit below last year at this time, but I think it's due to timing. When I look at mainly it's always our EI and preschool program, just getting those information in. Regarding employee benefits, again, slightly over. Again, it's due to the contract change, and obviously taxes and everything would go up. The one thing I did want to mention regarding revenues is the preschool program had a little bit of a glitch in the state system. So they've held off for us, allowing us to bill for our expenses. We just got last week word that now we can go, and that's due December 10th. So we're working on getting those in. So that'll bring those back up. And that's all I have.
The rest of the attachments are normal discussion items for rabies and emergency preparedness and things like that. So if anybody has any questions, you can let us know. Otherwise, that's all we have.
Rabies looks like it's lower.
Rabies is lower.
Yeah,
That's a good thing if we have.
No, I see that.
fights.
That's what I'm, no.
But I'm gonna just let you know on the human aspect of it, it's not lower. We have been swamped. And
Really?
I've already met the amount that we can get. We get 17,000, a little over 17,000 a year for rabies. And that includes for animals being tested. That includes the clinics that we do. And that includes all the humans that we have to, who come in contact, have to be treated at the hospitals. And we've already met that amount of the second quarter. So the second
But it looks like
6
we're gonna
months,
have
they're
an
gonna
increase.
be on the county, and then we'll get state aid on that, but unless somehow, which I always say I'd like to fight that we could get that, because that's never increased since I've been here. 17,000 a year, I can spend that on 2 families in rabies, so it's rabies vaccine is very expensive. I know I've said it before, but like the first shot for a lot of people can range anywhere from $15,000 to $25,000. We don't pay that, nor do insurance companies, but that's how much they charge. And that's because, I mean, Janelle could explain it, that's a medical thing. The first shot has got a lot more involved in it. And then the next one's run, I don't know, around 2,500. So that's one thing, but that first one is what can cost. And if you have a family or a person who's got a high deductible and they have to meet that, and let's say it's 5,000, there's 5,000 I have to pay. It just happens to fall under our time when we get the bill, whenever their deductible is. So between co-pays and deductibles is what we pay for They bill the insurance company if they've got insurance. If they don't have insurance, they still have to go to the hospital for that first one. We have a deal with the hospital. They will bill us at the Medicaid rate, so that's very good. And then the next 3, they'll come here to our office and we will give them the vaccine. So the human aspect of the rabies, we might not have a lot of bites, might even be just come into contact, but when they have to go for the treatment, that is the big expense with our county.
And historically, the way they come up with the grant is based on population. So some of your bigger counties get more money, your smaller counties get less money. But your more rural counties see more rabies activities than, maybe in the city. So it'd be nice if some advocacy could be done to try to help level the playing field. Or, hey, this is earmarked for you, but then if you don't use it, we'll use it to offset the expenses in the other counties in that 3rd and 4th quarter. But we've begged the state to do that, but coming from us and our contacts, we're not going anywhere with that. But that might be something to look at as far as the grant, how it's distributed and what happens to the counties that don't utilize those funds, and could those funds be filtered back into the counties that have broken the budget, so to speak. But just to be clear, I mean, not that you would get 100% of the expenses, but those expenses are eligible for state aid, so we get some reimbursement, just not as much as we could have if we had more grant money.
Okay, anything else? Well, before we end, I'd like to wish Supervisor Thomas a wonderful retirement. It's been a pleasure to serve on this committee and have you serve with us. And you will be sorely missed, sir.
Thank you, Jeremy.
So with that, we'll call for an adjournment. All in favor?
Aye.
Opposed and motion? Yeah. Oh, motion to adjourn, I'm sorry. We got the motion from Supervisor Wild and seconded by Supervisor Gilligan. Now all in favor. Gotta be paying attention.